Town Hall meeting powered by the Center for Closing the Health Gap. Your moderators today will be superstar Tropicana from The Wiz, and I'm Council Member Jan Michelle Lemon Kearney. Today, we're going to talk to Black men in medicine about Black men and medicine, including underrepresentation in the medical profession. We're going to talk about health challenges, life expectancies, disparities, and even solutions. So we've got a lot to talk about today. In a minute, you're going to meet our panelists. First, let me thank our tech team, John Reichel and Lauren Harden, and remind you that we are taping this session so that we can repost it for those who are not here at the moment. So if you're on Zoom or Facebook, feel free to go right ahead and start entering your questions, and we will get to them in a moment. But first, let's hear from one of the founders of Black Men in Medicine, Dr. Alvin Crawford.
Well, good afternoon. First of all, I think it's important that we thank Michelle, Renee, and Tropicana. And that's Jan Michelle. I've known her for a long, long time, and I don't want to blow that. But anyway, it's a pleasure to be on this show and to illustrate and accentuate some issues that we have come across. And that is the diminishing, discouraging, and depressing entrance of African-American males into the medical field. There are some little secrets that not known. There's little gain in the African-American male medical school admission since 1978. As a matter of fact, the male population of African-Americans only comprise about 3 to 5% of African-American males that are involved in the activity. And it's been a long time coming, but I think we've been aware of discrimination and racism for a long, long time. And so let's see what some things that we can do to combat it. It's important to know that there have been little gains. The goal and the purpose of our organization is to support, to assist in recruiting, retain, sustain, and then graduate African-American males who are pursuing careers in healthcare. It's important that we do the field of medicine, but there are other fields, technology, technicians, and we want to make it a big picture and to bring as many people as we can into the party. It's been found that African Americans, and especially as we get into males and middle-aged males, have either a trust factor or they're more compliant when they've had proactive health measures. Those that are for diabetes, for exercise, for high blood pressure, diet control, and including what can be mentioned today, and that is vaccinations. They've been more attentive when it's been recommended by African-American male docs. And so we would like to sort of give you an idea of what we're trying to do. We're trying to take African-American healthcare trainees at whatever level and to help them to resolve the conundrum that I can't be one if I don't see one, and that we want to associate them with African-American physicians, technicians, and others in the healthcare field so they can get a feel for it, can go along with it, and we can pass along mentoring. Mentoring is an interesting situation. It means sort of to help. Actually, it comes back from the Greek when one of the Greek children were left with mentor and was able to bring them up in the absence of his father. It became something of mentoring. So we want to mentoring. And mentoring is also interesting because males who've been mentoring, and then maybe others, through academic exercises, have been able to score higher academically. And I think that that's something we haven't calibrated into actual statistics, but it's not been known that it can happen. What we can do is that we can give real-time advice on managing, countermanding systemic and structural racism, and becoming more comfortable within themselves. And that see one, be one, do one, I think has a lot of effect to that. And this is what we're trying to get them to embellish. So if we can expose trainees to competent, compassionate, empathetic, and caring physicians who will instill in them a trust factor level of comfort, then that may cause them to be able to recruit others into this area. But also, I think that those factors will allow not only majority populations, but more African Americans will seek them for their healthcare needs, in addition to medical as well as surgical needs. And so that's what we're trying to achieve. When we look back at the statistics, they're fairly dismal. And then nationally, of 21,000 medical students currently enrolled, 3% or less are African males. And those statistics have to do, it takes a while to gather statistics. So they're a little bit aged at this point in time, but it's never been, and we looked at a 120-year sphere, and it has not changed or improved since then. So we're a mentoring service. I actually call it sort of a dating service, that we want to connect African-American and trainees who are interested in the healthcare field to connect with one of our docs to get advice, to get support, to get comfort. We've started, as you know, but I should let you know that we're less than a year. We were given permission from the Dean of the College of Medicine in September. And so everything is virtual. So this is where we are. It's amazing. When I talk about dating, it was sort of two groups that came together. I wanted to get involved in this. I've been a pediatric surgeon pretty much all of my life, but wanting to get into passing along to younger people who are interested in this. And my team, I should show you my major team. This is Mike Deal, Adam Butler, Austin Thompson, and Derek. And I found out they were interested in the same thing I was. And so we bonded to make this happen. And from that, we were able to recruit others. And the others are very, very, very important. I don't really know whether I should start at the top or the bottom, and I don't know how to do that. So I'm going to start at the top. Dr. Michael Thomas, who is on this screen, is the first African-American full professor and director of a department in the 200-year history of the University of Cincinnati College of Medicine. Someone who hopefully will be taking that particular status is Dr. Lester Duplechan. He's a physical medicine and rehabilitative expert, and he has started a fellowship at the University of Cincinnati, and we look forward to great things for him. In addition, Dr. Conrad Cole is a pediatric gastroenterologist. He will be handling, we've got it set up so those who are mature and senior who have rehabilitative efforts will have Dr. Duplechan. There's always a question of pregnancy and this disease, and Dr. Thomas is here, and then Dr. Cole, who's a pediatrician, and pediatric patients have recently been brought to the party because of some change in the dynamics, as you well know, and I'm sure he'll be able to express them. So that is my panel. We're prepared to go into whatever area that has to do with what we can do and what we would like to be done to increase the number of African-American males, simply because for whatever reasons, disease tends to affect African-Americans more than others. As my friend Clyde Henderson, I was his mentor, and now he is my mentor in COVID, that if racism was a killer, then the pandemic is a mass murderer. And we would like to do what we can to make sure that we can resolve all those things. So I'm going to go into a bit of silence and let our team take over to answer whatever questions you might have. Thank you for your attention.
Thank you so much, Dr. Crawford. We have some questions from some of our listeners, as well as some of the Black men in the community here in the city. One of the biggest concerns that we keep running across for 18 to 40 is the issue with stress and how it affects the body. Some of the Black men that I've spoken with and that call in want to know what are things that they can do to alleviate stress in a world that is designed to stress Black men out, for a lack of better words of saying it. Could you guys speak to stress and how it affects the body for young Black men and things that they can do to alleviate or deal with it?
I can speak to that because for one thing, it's in my field. I'm a physical medicine rehabilitation physician, and we try to cure almost everything with exercise. So if you think about it, the patient who's just had a stroke that we have to teach how to walk again, there are no instructions for walking. It's something we've always done. And so one of the things we teach patients is that the best exercise to learn a particular task is that task. And so we help them at the beginning to learn how to walk and to learn how to turn and do stairs and everything else. But one of the things that we forget is that one of the best medicines in the world is exercise. So if you think about it, exercise not only gives you that great feeling and endorphins and everything else to help relieve stress, but think of the major killers of Black people: hypertension. We're very quick to give people pills, but very often do we tell patients, I need you to take a walk at least every other day and to find other things that you like to do. I need you to do some sustained exercise. It's very clear that exercise helps hypertension. Hypercholesterolemia, exercise helps that. We talked about stress and mental health. Exercise helps that. Diabetes, lowering blood sugar, exercise helps that. And even even if you think about some of the GI problems that people have, constipation and other things, exercise helps with that, getting better gastric motility. So you know, we learn all these fancy things. We have all this new technology to treat people, but some of the most basic things are most helpful for patients. So I ask patients to find a time every day to do some sort of exercise. I personally do not love exercise, but I've learned to utilize exercise to meet my habits. And I'm going to be personal about this. I've been very lucky in my life to never have to take medication. But hereditary wise, I have gotten some things handed down to me from the generations. And one of them is high cholesterol. And I've done everything that I could to bring my cholesterol level down. And it really took the combination of exercise and changing my diet to keep me from taking some of the medications that I didn't want to take. And thank goodness it didn't take a lot, but I really didn't want to take statin medications. And so I found that if I just exercised a little bit every day and changed my diet, that I got to the point that I could bring my cholesterol level to the correct level. So again, not somebody who loves exercise. Personally, I learned that if I got up 30 minutes earlier every morning and did exercise before my day got out of control, I could never give myself the excuse that I got too busy to exercise. And before you know it, if you do it for 21 days, it's a habit. And so you know, some of us are very type A. I've got a streak going of over 365 days in a row of at least 30 minutes of exercise. I don't want to break it. I don't. My watch tells me it's time to exercise, and I look at my watch at the end of the day and I come home and I'll find myself exercising at the end of the day just to keep the streak going.
That's fantastic. You know, so I want to go back to the whole trust issue that Dr. Crawford, you mentioned that, and that's a big part of healthcare. So let me just tie that in with this lifespan issue. We keep hearing that Black men have the highest mortality rate of just about any group. In some zip codes, there's like a 10 to 20 year gap. The Urban League did a study back in 2015 showing in some zip codes, Black men had a higher mortality rate by about 20 years than people in other zip codes. So is part of that because of the lack of, compliancy with healthcare, and which goes back to what you're saying, lack of trust? Just tell us about that. And it doesn't have to be Dr. Crawford. Anyone can answer that question.
I think that this is Mike Thomas. I think that, it's very difficult. I think most Black men, and I see it even though I see primarily women as patients, but because I deal with fertility issues, I also have to see the men as well. And it's very difficult to get the men into the doctor's office. There is a lack of trust, and there's also this lack of invincibility that you see not only in men, but you also see it in teens and young adults. that nothing could ever happen to me, that I could never get sick. But unfortunately, that is not the case. And when it comes to fertility issues, sometimes fertility could be caused by stress. My research when I first started at UC was on how stress in general affects women, that we can artificially give medicines to increase your stress levels. And then we could look at, I was looking at LH pulses, how the pulsatility of your hormones decrease if I give you more cortisol. So stress does affect things, and just the stress of life. We know it's just living in certain environments, living in certain area codes is going to affect it's going to increase your cortisol level. I'm a endocrinologist, and I see people coming in these stress states. Either their cycles will shut down. We see this a lot when people are about to take their midterms and their final exams. Everything just sort of shuts down. But stress can have an overall effect. It's hard to measure it because even if you just draw a cortisol level, it doesn't necessarily, your stress hormone level, it doesn't necessarily tell you anything. But just living the stress of life can affect things, but you don't help it when you feel invulnerable and feel that you can't go to the doctors, because as Dr. Duplechan said, your genetics will catch up with you sooner or later. And then just stress of life. And sometimes not just exercise, but even seeing someone to talk to, talking to your primary care doctor, to talk to, potentially refer you to a counselor, social worker who you sit down and you can talk to about problems, which has been shown to also help reduce stress.
Except, you know, if you
Dear
go
Michelle.
and talk to these professionals, and Dr. Crawford, I'm just going to echo something
Sure.
you said. If you talk to
Okay.
these professionals, but they aren't Black males, then maybe that's not going to work. So that's my question. Dr. Crawford, jump right in.
There is some data. There's nothing better than data. And there's a parallel study that's out of Stanford and Oakland that has shown categorically when the same recommendations were made to, especially, and it's males that are getting into the older ages, say past middle age, their compliance in terms of these are things very similar to what Dr. Duplechan was saying, routine things, not heavy lifting and so forth. But their compliance, their ability to follow them, and their trust. And trust is something that can't be, you know it when you have it, but you can't necessarily say what it is or isn't. But that's a factor in it, that their trust and they're not suspicious of what they're going to do. And they sort of, it's someone who looks like me that I can trust. But anyway, there's a study now that showed in a cardiology clinic, there was a 19% increase in longevity of African-American males when they were paired with African-American physicians as opposed to majority physicians. That is the only documented data that I'm aware of now, and it's just recently out. And it's realistic, and I think it's a pattern that we'll all fall into.
But you know, now given that the population in medical schools is only 3%, and you guys always shock me whenever you give me that number, that it hasn't really increased since 1978. I mean, that's a long time. What's the plan? What are we going to do about that?
I think, yeah, out there. I think the plan is that we need to start early. We need to go into the communities as early as possible. Grade school, we don't have to wait until people get to college. I mean, as Dr. Crawford said, you know, you become who you see, right? You have to see people to try to emulate them and want to become like them. And I think that's part of why we're set up. And this is what we really have to do, is start as early as possible, get to the kids as early as possible, provide, you know, some sort of support so that they can see that they can be what they see, right? I think that's the key thing. The other thing, again, you know, that I think we sort of like just, we mentioned a little bit about, you know, communities, right? You know, we have to think about the issues we have in our communities here. I mean, there's significant and there's sufficient data to show that if you don't take a child out of poverty by the time they're 12, 13, they're going to be stuck there. So that's also a bigger issue that we have to address, because kids or even young adults, you know, think that they can't, you know, progress in the medical field because they cannot afford it. And so they're stuck because of the environment in which they are, what they see around them. So that's something we really have to to focus on going forward.
You know, one of the
Dr.
things
Cole.
that I've been doing is taking simulators, surgical simulators that help doctors teach kids how to do, teach doctors how to do surgery. And there's a company that we work with, Hologic, and they have only 3 in the whole country. And they give me 2 to go back to my old hometown. It's called Robbins, Illinois, which is an all-Black town south of Chicago. And every year I take those 2 of those 3 simulators to Robbins, Illinois, and teach those 7th and 8th graders how to do surgery and give them the opportunity to know that they can potentially do a surgical procedure. And over the last 7 years that I've done this, I have kids now who are pre-law, pre-dent, pre-nursing, pre-pharmacy. So Dr. Cole is absolutely right. It's not just the high school, but it has to be even before high school. But one of the things that we're going to try to do in our department is to adopt a high school and try to work with the young ladies in those STEMs who want to be potentially STEM students by taking the simulators, taking our residents, going into the schools and trying to be role models and trying to work one-on-one with these kids to try to increase the chances at Hughes or Woodward or, you know, one of these places that would allow us to come in and talk to them. So I think that it has to start, and it has to start early.
I have a question.
I'll allow you. They'll be so excited you're coming in. I mean, that's huge. That's going to be really great. Thank you for that.
Jan Michelle, I'd like to ask a question. As you guys are addressing that there are issues with poverty mentality and growing up in these economically challenged neighborhoods, what can parents do? Young parents in particular, Gen Z parents, millennial parents, a mother like me who has a 5-year-old, what can we do to encourage, or what kind of programs can we put our kids in to introduce them into the idea of getting into medicine? What would you suggest?
If no one will start it, the one thing we've found is kids reading, the skill of reading, because reading actually advances to test taking ultimately. But having him to be into, as a matter of fact, there's a group, Black Men in White Coats, that talks about going into the early areas, like Dr. Cole said. I said, but sometimes kids don't have the mentality that, he said, you know, it's not important that they be doctors, but it'll teach them that they want to be somebody. A doctor is a good hit to achieve and can get them to the point of reading and test taking. That has a lot to do with it. And we'd like to, if Black men in medicine can work, then you would have a young child and be seen by your friends, majority or other, of a healthy young African-American male, and not hear, and not that it's derogatory, that, boy, your son's really a good-looking kid. Boy, there's a possibility of making the NBA, Major League Baseball or whatever, but to have a one day to say, well, that's a good-looking kid. You know, one day he could maybe be a doctor or a scientist.
Right, right. Just changing the narrative.
Change the narrative. That's right. So can we go back and talk a little bit about some health concerns? Because, you know, we've got all these doctors, and I know our audience wonders about some health questions. For example, what are the top health problems facing Black men, and what can we do about it?
Oh, I'm not an adult physician, but the documented things are such things as hypertension, cardiac diseases, pulmonary diseases. They probably, and diabetes, that probably hits as the top 3. And that's a lot of work, but the things that Dr. Duplechan was saying in terms of there's simple solutions to that. And, you know, he was his own control and going through that experiment to show that the things that he's recommended, and he is an excellent physician in the terms of rehabilitation and taking care of that sort of thing, of what can be done.
Yeah, I think that there are a lot of lifestyle changes that have to be done because of the issues that Dr. Crawford just talked about. I never saw a salad till I was in college. I think that, and this is going to be my next controversial statement, I think McDonald's has killed more people than cigarettes. So I am of the mind, and that could be any fast food place, any chicken place. I am of the mind that there are just not I think that we have a lot of unhealthy habits combined with our own personal African-American genetics that increase the chances of us having issues. heart disease, diabetes, so weight issues, even your genetic issues and risk, hypertension. I have hypertension. My cholesterol is good, Lester, but I have hypertension. But it is just one of those things. I think our lifestyle, we have to get into a healthy lifestyle. Walking, I go to Glenwood Gardens every night, walking the dog, and that also helps alleviate my stress. So you have to get into lifestyles, especially as you get older, because your body doesn't get backed again anymore. Over time, your thyroid hormones may change, your metabolism in general may change. And as you get older, you have to get on track and to try to keep a more healthy lifestyle as you get older.
Okay.
It's all about habits. I mean, the earlier you start, the better you are at it. So I think that's also key. So again, going back, in terms of childhood, exposure, try to get educate the kids in the schools. And as Dr. Crawford talked about the reading habits, one of the things that Cincinnati Children's does is the No Child Left Behind, right? I mean, in terms of getting to the preschools as early as possible to try to get kids reading early.
Okay. Well, and when you talk about, going to fast food places, because, low income neighborhoods, for example, a lot of them are just food deserts.
Missing grocery stores, right?
A healthy place to go. So like driving by that fast food place is, that's where we end up going. And maybe that's part of the whole systemic racism, Dr. Crawford, that you mentioned. And so going back to what you were saying, your number 5 on your list was real-time advice about how to manage systemic racism. Can you talk about that? What kind of advice can you give?
Well, I think when you're dealing with the youngsters, this would be people who've gone through that. You can't live on this earth and get to that particular age and not have encountered all of the above, which has to do with not only systemic racism, as Mike was saying, a structural racism is, where is the location? The location of their homes, their dwelling devices could be near a septic area. It could be near factories. It could be something that's having fumes all over the place. It could be a lot of other things. And as a result of that becomes the systemic racism that you do. And that can predispose to some of the other things. It may not be that you have necessarily bad habits, but your environment, multifamily dwellings, there's a lot of things that can affect that. Now, what can we do about it? I think that was your question. When we look at what we would like to have with the mentors, they've been through all of this, and hopefully they have been, as my granddaughter would say, they are woke now, and they can pass this on to children and to the family, to parents, especially pediatricians, when they're dealing with them, to know what a healthy lifestyle is, pursuant to what Mike Thomas said, and to get into that in an early age. And it can't be too early to get it started. And then once those habits are there, and with our program, that there would become a relationship that would be developed, and the child would see this and would want to emulate it because it would recommend success. And I think every human is interested in success.
Absolutely.
Absolutely. Duplechan, I'm sorry, I didn't mean to cut you off.
No, you didn't cut me off. I was agreeing with Dr. Crawford. I was just thinking, Dr. Crawford, for the program that you guys host, the mentor program, how can people get in it?
Well, the entree at this particular time is someone who is involved in the study of healthcare, and it's not just docs. We have a tiered program that we started. The way we started it is that we started with the freshman medical students, the sophomore medical students. We're now to the junior medical students, but our intent as it was designed, UC is one of the few schools that has a biomedical science program in the undergraduate school. We were to go from the medical school to the undergraduate school to the high schools and then filter down. We're 6 months in. It's a work in progress, but that is our ultimate goal, and to have the same parameters at each level and achievement for us would be to change the dynamic of how the child is growing up.
Wow.
I'd like to get a little personal right now. Because I'm looking at all of you, and our audience is looking at you, and we see these, very accomplished, I mean, you're all tops in your field. and we're very proud of you. And I just wonder, for people listening in, especially young people, are they thinking, well, it was easy for you. This, you grew up wanting to be a doctor. You grew up knowing this is where you were going to end up. Or did you overcome some obstacles? Did you have, what was this a change in mindset? Can you tell us your personal story, how you ended up in medicine? Each one of you.
I don't know who wants to start. I can start. I grew up in with basically projects in Robbins, Illinois. Robbins is a small all-Black town. It was settled back in the early 1900s, and it was good because everyone was your mother, because you get in trouble you had the lady next door, Miss Ruth, would make sure you were on the straight and narrow. So it was not the path to medicine, but the path of medicine was just sort of knowing that you had to get good grades, but it was actually more than that, because there's so many other things that take place. Getting into a good school, doing well in high school, but trying to stay away from the things that could turn you in the other direction. And I say the path to medicine in my mind is just trying to have a strategic plan from grade one, and being able to at least see other Black doctors, talking to my own personal doctor who wasn't Black, but who understood that that's what I wanted to do even as a young person. So having mentors early on who helped get you into things, working at the hospital, things like that help to keep your mind focused on medicine as a lifelong profession.
So you started really young, knowing that medicine is something you were going to do.
I started at probably 8 or 9, knowing that I wanted to be a doctor. Yes.
Okay. And then your mentors helped you get there.
Well, that you help yourself, but yes, my when I would see my pediatrician, I would he said that, yeah, you could probably do this too, but yeah, I mean, it was always nice. He helped write my letter to Northwestern when I got into Northwestern. He was one of the people who wrote my letter when I got into Northwestern as a film major, which also was a strategy because it was easy to get A's in film. And then I was a radio TV film major, and we had a TV station in high school, worked, got in it. I knew that was the easiest way to get into Northwestern, and then used those A's and TV and my other grades in science to get into medical school.
All right, good for you. Okay. Dr. Cole, how about you?
So, I mean, I also early on felt that this is what I wanted to do. I am originally from Sierra Leone, migrated after college, but along the way, I did meet someone who actually did guide me through the process. I mean, it wasn't an easy process, but getting guidance and looking at someone, and the person actually who did just like Dr. Thomas was not someone who looks like me. He absolutely did not look like me at all. But he guided me through the process and helped me through residency. And then when it was time for me to decide what I wanted to do, because my thought was, as a pediatrician, should I do emergency medicine or endocrinology? And he told me no. I mean, he was an endocrinologist and said, you should become a gastroenterologist. And that's where I am today. He basically picked up the phone and called someone and got me into a fellowship program. And I think, again, you have to have people along the way who are going to guide you through the process. I mean, that's what that particular person did for me.
Okay, wow. Good to hear. And that sounds like that's what Black Men in Medicine is aiming to do as well.
Absolutely.
Okay, Dr. Duplechan.
Yeah, I have a different story. I had no idea that I would be a physician. So just a little background, my parents migrated from, as some would say, deep Louisiana. My father's education stopped at the 7th grade because it was too expensive to take the bus to the colored school there in Louisiana. And so he ended up going to the Korean War and coming back and kind of building his life. He started off at Lockheed in Burbank, California, washing planes. And through the GI Bill, went back to school, went to what is, I think, considered ITT Tech today, but worked his way through vocational schools and became an electrical engineer. But he always told us how important education was. And so we were living in they call it South Central LA now, but it was South LA. And, there were very few projects in Los Angeles. Los Angeles is a very different looking place. It's got nice lawns and nice streets, but it's the hood. Right. And my parents made a strategic decision to move us to an area that had good public schools because we couldn't afford private schools. And all they kept telling us was get an education. That's the way for a Black person to get ahead. So I had no idea what I was going to do, but I knew that I would be going to college because that's what my parents wanted us to do. They didn't have the chance. My oldest brother, Larry, was the first in our family to go to college and get a college degree. And with my parents, all four of us ended up getting college degrees. But I was studying engineering, didn't really know what I wanted to do, did a summer job after my first year, and realized that most of the people I was working with were 45-year-old men in an airplane hangar. And I thought, what am I doing here? And I love the field, but I realized I was more of a people person at that time. And in studying engineering, some of my friends were studying pre-med, and I thought about it. My part-time job was working as a nighttime security guard at a clinic. And I noticed that as people would ask me directions and ask me to help with patients, that I kind of liked helping people. And I thought, what the heck, maybe I should go for it. Being the youngest of four boys, I've always been a gambler. And I said, you know what? I'm going to wait till somebody taps me on the shoulder and tells me I'm not supposed to be here. So I changed my major. I had this big, I went and told my dad that I was going to change my major and it would take me 5 years to graduate undergrad instead of 4. And I thought he was going to throw me out of the house, and he didn't. And nobody's tapped me on the shoulder yet. It hasn't been easy, but there are people who walk into your life. There are people, that little old lady who sits in the front row of the church who puts $5 in your hand because she thinks that you're somebody when nobody thinks you're anybody. Those are the people in your community that are behind you, whether you know it or not. And Tropicana, you had a question earlier about what do you do with your son, your 5-year-old son? Find somebody in the community, find somebody at church, somebody, when somebody asks me, can you speak to my child? All of us will say yes. All of us are willing to open the door. I've had patients come in and say, I know a young man who wants to be a doctor. Are you willing to speak to him? And you just never know when you're going to plant the seed in somebody. And as Dr. Crawford likes to say, you have to see it to be it. And, somewhere along the line, somebody told me, keep going for it, you can do it. And that's really what it takes. With these food deserts that we also have healthcare deserts. Everything's stacked against us. But if we get ourselves prepared, we can do anything. I'm living proof. I was the runt of the litter. I was the one least likely to succeed in my family. I had brothers who were more talented in music and art and sports. And of course, I'm over 6 feet tall, so everybody asked me about my basketball acumen. I still get asked that today, but the reality is you never know what diamond is in that child's mind. And so all you need is 1 or 2 people to let them know, keep going. And so as you can see, my passion is mentorship. And it doesn't matter to me if it's a young man, young woman. I know if they just kind of stick to it and get a little bit of support, a little bit of a nudge. And sometimes we have to give some, come to Jesus talks, and let people know you can't do everything at once. You're going to have to prioritize. I have that with my own children. It's very different for me now to have these children who think everything's okay because all they knew was having a Black president. They don't know what it was like not to have a Black president. So they're like, what's the big deal? But we have to remind our children that you still have to be the best. One thing my father always told me, don't be average, be the best. If you're not the best, they don't need you. And I may not be the smartest person, but I'm going to outwork you. That's my job.
That's right. That's right. Thank you, Dr. Duplechan, on that. Now we didn't get a chance to hear Dr.
Dr. Crawford has to tell his story. Wait, hold on, Tropicana. One second.
My story is.
I wanted to hear his. I wanted to make sure that we got his.
Okay.
It's completely different. And let me tell you what, the most supportive person who fit all the roles and all the shoes in my life of three of us to make us aware that we could do anything we ever wanted to if we worked hard enough is my mother. And she mentioned a single parent and a mother. And I hate to say this because it's an unbelievable responsibility. And there were three of us. But she let us know early on there was absolutely nothing whatsoever we couldn't do if we put our minds to it. As a matter of fact, I went to college as a music major and still consider myself a musician today. And I was at Tennessee State University, was playing in their bands and all over the place. And I thought of what I was going to do. I wanted to be a studio musician, but not being from a conservatory, those guys are good. So my older brother, and I did everything he told me to do. We were probably the cast type for Slumdog Millionaires. And that whatever he told me to do, I did it. And then I had a sister who, if I did it, she would rat it out to our mother. So it was a cycle. But anyway, growing up, I had a fairly good high school. I tested out at the 10th grade, but didn't have the money to go to college. Became a music major. And my brother said, you've always been in the challenges. What would you think of medicine? I said, well, I haven't thought of medicine at all. He said, it's a challenge. I said, I think you're right with that. But nevertheless, and then went directly into the prerequisites and got accepted into Meharry. At that time, and you can appreciate these times, I was in the state of Tennessee. The state of Tennessee did not allow African Americans to go to their university. It was completely segregated. However, the NAACP was on their case and said that it should change. And they said, well, we don't have any African Americans that are qualified that have applied for admission. And so my mother worked as a nurse, and they said she was in an African-American hospital. The chief of surgery there said, your son's in medical school, how's he doing? Well, that's the worst question you could ever ask my mother about either of her children. That was a 3-hour conversation, and she would tell you in detail how each one of them was and what they had achieved within the last several hours or no less than weeks. But anyway, she said, he's fine. She said, well, we didn't have the privacy laws then. So would you mind if we submitted his application to University of Tennessee? She said, well, no, he's in Meharry and things should be, that shouldn't be a problem. And so they did. And then it came out that there was one applicant, but he was in medical school and wasn't a problem. We looked at it having mortgaged the house and having not one penny that the cost of the medical school, the state medical school. Meharry is a private medical school. It's very, 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 very good. However, it's expensive. And so we said, well, why not? And I said, well, look, I'll do it. And she said, will you transfer? I thought I could transfer. But the authorities said, well, you can't transfer. We don't consider your grades at Meharry to be accredited. And so you can't. So I said, well, fine, I'm in this part of it. Nevertheless, I went as the first African-American in the Southern medical school system and was able to finish well in the top of my class. And life has been good to me in terms of selecting my career. I was able to finish the Harvard University program in orthopedic surgery and the first graduate there, and to go on into ultimately becoming chief of orthopedics at Cincinnati Children's, and from there in the Pediatric Orthopedic Society, to be fortunate to, in every area that I've been thus far, as a pediatric orthopedist, the Lifetime Achievements Award, the Hall of Fame awards, everything, they've come, but it has taken hard work. I think some of it was some God-given talent, but at the end of the cycle, the motivator, the prime push for me to do, and for my brother and sister, whatever we thought we could do, was my mother. So my answer to Tropicana is she has an opportunity, and not to put pressure on her, that she can influence the directions that her children, because there has to be an influence. There's always an influence. Do you want it to be the drug dealer? Do you want it to be other things that may be unsaid? There has to be an influencer. So then you become the influencer, and with the proper influence, can pretty much mold and make a child whatever you'd like for them to be. especially in getting their interest in their love. And that's a long, long story that's short.
You know,
That was an amazing story.
One of the things that I think that you can hear is this: you have to have this sense of entitlement. You have to let people know that you belong. One of the things I realized at the white folks at Northwestern, because there were only 10% Blacks at Northwestern, these guys would come in and they act like they belong there. So I started to act like I belong there. And no was just an answer. You can always, you have to have people help you get to yes. No is just one answer. So the question is, how do I get to yes? So you have to come into the door with that sense, with that, you know, what did my daughter's named after Maya Angelou. You know, you have to come in with all the bells and jangles, like I got gold, you know, whatever. I don't remember the poem, but I do remember the fact that you have to come in there with the idea that you belong. I don't care who else is here. You told me no, but who's going to tell me yes? And you got to get to that person who's going to tell you yes to get those doors open.
Wow, that is amazing advice from all of you gentlemen. Thank you, Dr. Crawford. I'm going to take your challenge on influencing. Dr. Duplechan, I heard you on mentorship. And of course, Dr. Thomas, you're absolutely right, having a sense of belonging. So thank you guys for that advice. I think that was from me as well, not just my son and the other people, but I know that we have a lot of single mothers who need to hear these same words, because we want to make sure that we're rearing our children in the right direction to be much more like you gentlemen than the things that they see on television. As we kind of transition the conversation back into COVID-19, we had some new mandates that came down this week from the CDC. Before we get out of this conversation, is there anything that you guys can speak to that? There's a lot of confusion, especially on social media, with the CDC saying that we no longer have to wear a mask if you're vaccinated, but they also are not requiring you to show a card that says that you're vaccinated, and we don't know who's vaccinated and who's not. Is this a safe protocol? What would you suggest to us as we are venturing back out into the world, or having to not have a choice to venture back out to protect ourselves and our families?
You know, I solicited Dr. Cole to speak to the pediatric aspect of it that's just come about. That's probably the latest information that's out there.
Yeah, that's right. I mean, on May 10th, you know, there was approval that, you know, kids as young as age 12, right, can get the Pfizer vaccine. So that's awesome. So at least we are hopeful that, you know, parents will allow their kids to get in and get vaccinated. I mean, most of the school systems have clinics that are running. The hospital here at Cincinnati Children's has that ability. So that is definitely one thing. In order for us to get to that level of immunity where we will all feel comfortable, which we're not at this point, but we need to get there, we need to vaccinate the kids. So 12 and above, you know, can get vaccinated for sure.
So, you know, what do you all think about, you know, Tropicana brought up, you know, the CDC's new orders about now we don't have to, if you've been vaccinated, you don't have to wear a mask even inside. So this is all new. Before we, you know, they said if you're vaccinated, you don't have to wear a mask outside. Now we don't have to wear a mask inside. I think unless you're like in a healthcare facility or a nursing home or business can require you to, but other than that, you really don't have to. And it's really confusing. What do you think about all these orders coming down?
Well, I talked with Dr. Edgy, and I think she is probably the expert in this area now. She's been all over TV and everything else. She's been sort of a mentor to me in getting this, and it's so confusing. But I think the bottom line is that you can have the disease and not be symptomatic at all. And you can spread the disease. But if you wear a mask, you have less of a potential of spreading it to others, your loved ones, your workforce, and so forth and so on. So she said, for that reason, until it comes down within a reasonable situation and without a doubt that you are protected, and it has to do with the herd community having it. That is, the 70 to 85% of people are protected in some way. Until it comes to that, then the mask would be the thing to do. And to not only think of what it can do for you, probably little, but what it can do for others that you come in contact with, including your loved ones and your family that you spend lots and lots of time with.
Yeah, what do other people think? Because Dr. Crawford, I'm totally on board with that. I think we're taking those masks off too early, and that really
Yes.
scares me. You know, Franklin County and Columbus were purple not that long ago, last month, and so I just think we're really setting ourselves up for failure in terms of overcoming
setback.
COVID. If we tell everybody, yeah, for a setback, if we tell everybody it's okay.
I think
And like
that there,
we don't know who's been vaccinated.
right. I think that there is some degree of, as Dr. Dr. Crawford was saying, there's some degree of forcing some degree of herd immunity on everyone, because we have a number of people who are vaccinated, but that's starting to plateau, even though we need more vaccinations, especially in communities of color. That's very, very important. But I think it's getting to the point that people who haven't been vaccinated obviously need to continue to be encouraged, but by people taking off masks, that's going to potentially pass on some degree of disease to others to try to increase the chances of herd immunity. But unfortunately, as both you and Tropicana said, you may also start to see a blip in disease state and a blip in deaths during this stabilization period.
Okay, and then here's a question coming from Facebook from Lemmy Johnson. And she said, how long is this vaccine good? Will we need to get a booster every year? I don't know whether we've ever really gotten a real answer to that. People ask that every week.
Yeah, well, I mean, they're still looking at the data. I mean, for people like Dr. Thomas, they're probably still getting their levels checked quite often to see, you know, what whether it wanes. I mean, they're definitely looking at how it reacts with the new variants as they come. So the answer this time is we don't know. I think that should be the honest answer. But I mean, it might change. It might change by the fall when, you know, we do see even in the normal, you know, without the pandemic, you would see a surge in terms of, you know, viral illnesses. So it probably might change at that time, but until we get more data, the answer at this time is that we really don't know if we're going to need a booster or not.
As Dr. Cole alluded to, I was in the study, the UC Moderna study. So I got my first vaccine, found out later, got my first shot in October, my second shot in November. And I was just there because I have to go in every 3 months or so to get blood drawn. And I was just there and I asked about that. I asked, when am I going to be getting my booster shot in October? And the lady told me they have no, at this time, they have no plans for boosters. And so I just assumed they would, but as at this time, they are still trying to figure it out by the blood test and whatnot that people are getting, and they are being very. I know Dr. Fichtenbaum and his group are working very hard with the Moderna, and then the group with Pfizer, and I am sure there will be boosters, but it's unclear right now how long these vaccines will continue to last and give protection. But I should say, they also seem to be protecting against the variants.
Right, those variants, yeah. I want to circle back to where we started when we talked about, you know, Black men and trust. So how are we doing with getting the vaccine? My understanding is that the number of Black folks getting the vaccine is lower than the general population. So are we looking at a trust factor problem?
One thing that I've heard amongst
possibly so, in terms of we have that situation and I'm maybe in the younger generation, it won't be there, of being brought into the medical arena for things that may or may not have been in your best interest. Trust is extremely important, and I'll speak to the only thing I'd like to achieve with this project, and that is we've heard of Maya Angelou and the comments from Dr. Thomas, but she was having surgery. She was having surgery on her spine, and they said, well, boy, you can afford the best, you can get this, you can get that, you can get the other, and so forth. Says, well, what do you know about your doctor? Was he in the top of his medical class? She said, you know what? The only thing I really know about my doctor is how he makes me feel. And if we can embellish in these youngsters compassion, empathy, desire to make someone better, and project that to the humans who come to them for care, then we would have succeeded.
Wow. Okay.
Yeah, I mean, in
Pretty
addition
powerful words.
Yeah. In addition to trust, I think the other, at least, I mean, when you reaching out to our communities here, the other issues that people were having was access. So at the start, you had to have internet access to be able to register. That was a major, impedance in terms of getting folks from our community to be able to do it. I mean, and again, where would they get it? It wasn't in their communities. They had to drive or get to the bus to do it. The numbers are getting better. We still have to be out there encouraging people to at least go to the drop-in centers where the vaccines are available. I mean, there are now areas where you can just drop in and get vaccinated. People need to know about those. They can still check the websites, but you don't have to wait, to register to get vaccinated.
Okay. All right. Thank you.
I think what Dr. Crawford said is really the key, and that is we need to let people know why we want them to get the vaccination, not get it because I said so,
Right.
but get it because I care about you.
Right.
I want you to live. I want you and your family to do well. And I think that's the trust factor. I find that often when I enter the hospital room with my team, once that Black patient sees me, we have that connection. And I can see that they smile maybe now and they say, wow, okay. And he's the boss. And he's asking me he's asking me to make sure to take my medicine on time and to make sure that I do all my therapy and everything else. I think he really wants me to do well. And I think if we remember that we tell people, don't just, hey, get a vaccination, but we want you to get a vaccination because we care about you. That's what really changes people's minds. Rather than just the institution says you need to get it, we want you to get it because we really care. So I love the way you put that, Dr. Crawford.
That's great. Thank you. Tropicana, close us out.
I see she dropped off, so we have.
Oh,
Hi.
Harris,
First of all, I want
hi.
to thank you, Dr. Crawford, Dr. Cole, Dr. Thomas, Dr. Duplechan, and we must continue this conversation. And I think the fact that you mentioned the humanity that must be brought to each of us, that we must remember that we must save us, and that we must realize that we are taking the vaccine so that we each can live longer lives, healthy lives, and we must protect each other. So thank you for joining us today. Your comments, your conversations about mentorship, really helping people understand the humanity that we must give to one another during this time and outside of this time. We definitely need each other. And I'm grateful that we have all of you in this community. And so I thank all of you for your time and look forward to another conversation in the next few months, really further exploring our Black men's health, our Black men in medicine, our Black men in health professions as a whole, and what we all need to do together. So I thank each of you. You all have a blessed weekend, and thank you, Councilmember Kearney, and thank you, Tropicana, for moderating today's panel, today's session, and you all have a great week, and we must continue to lift up one another. So thank you.
All right.
Thank you
Thank
always.
you.
Have a great weekend.
Everybody. Okay.